Excellencies, distinguished delegates, esteemed colleagues, and fellow advocates for sustainable development. It is an honor to join this important dialogue at the 2026 High-Level Political Forum as we collectively advance global efforts towards Sustainable Development Goal 6 and reaffirm our shared responsibility to ensure safe water, sanitation, public health, and human dignity for all. I extend my sincere appreciation to the organizing missions and distinguished partners for convening this timely conversation focused on climate resilience, women-led innovation, and sustainable community development. Today, I speak from both professional experience and personal conviction. Nearly 50 years ago, I began my journey in epidemiology and public health, studying the spread and impact of waterborne and foodborne diseases. At that time, the world was confronting outbreaks and revealed how fragile public health systems can become with sanitation, water safety, and environmental conditions, especially when they fail in our communities. And decades later, despite advancements in medicine, technology, and global awareness, many of these same challenges continue to affect us and millions of people around the world today, because access to safe water is still not guaranteed. And without safe water, health itself becomes fragile. When we discuss water, we are discussing far more than infrastructure or environmental policy. We are discussing life itself. Water sustains the human body. It sustains agriculture, healthcare systems, schools, communities, and economies. And yet for millions of people around the world, particularly in vulnerable and underserved regions, clear, clean water is difficult and still remains difficult to access. As an epidemiologist, I learned very early that contaminated water systems became pathways for disease and human suffering. Diseases such as cholera, typhoid fever, dysentery, hepatitis A, salmonella infections, gastroenteritis, parasitical illnesses, infections to threaten communities where sanitation systems remain inadequate and clean water remains inaccessible. These are not simple medical terms from textbooks. These are the realities experienced in families in every single area today. Children suffer from dehydration, mothers caring for sick infants without proper sanitation, communities struggling with recurring illnesses because the most basic necessity of life still remains uncertain, which is water, clean water. And while public health systems often focus on treatment, we must remember that prevention begins long before a hospital is ever needed. Prevention begins with clean water. Many of us gathered here today live in environments where water is immediately available. We drink it without hesitation. We bathe with it. We wash our clothes. We cook with it. We clean hospitals, schools, and our homes with it. We rarely stop to think about the privilege of turning on a faucet and expecting water to flow. But for many women and families around the world, daily life looks very different. And without reliable access to clean water, maintaining hygiene becomes difficult. Simple daily activities become major challenges. Families struggle to safely prepare food, wash clothing, care for newborns, or maintain sanitary living conditions. Women and girls often carry the greatest burden of this crisis, of course. They are frequently responsible for collecting water, caring for children and vulnerable family members, and managing the household sanitation, often while lacking adequate support, infrastructure, or representation in decision-making processes. This is why women's leadership must remain central to conversations surrounding sustainable development and water access. Because women are not only affected by these realities, they are often the ones holding communities together in the face of them. Water also affects every system within the human body. Our body itself is largely composed of water. It's actually 92%. Hydration supports circulation, immunity, cognitive function, nutritional absorption, muscle performance, and overall physical well-being. When people are chronically dehydrated and exposed to unsafe water systems, the consequences extend far beyond temporary illness. Children struggle with growth and concentration. Malnutrition intensifies. Communities experience declining health outcomes and reduced productivity. Healthcare systems become overwhelmed with preventable diseases, and the cycles of poverty continue to deepen. Without health, there is no quality of life. Without health, there is no sustainable development. And without water, there can be no health. Climate change continues to intensify these challenges. Flooding, droughts, water contamination, environmental instability, and placing enormous pressure on already vulnerable communities and public health systems. As we know, those with fewer resources often face the greatest consequences. Over and over, we repeat the same things with each of us as we represent our own dignitaries in our countries and our societies, but the actual goal is that we understand many of the solutions before us and that we have ways to reduce disease transmission, and it's up to all of us to increase public health awareness. I know we're short on time, but what we need is more innovation, partnership, and leadership. And the 2030 Agenda calls for transformation, equitable, innovative, and coordinated action. It's not simply a developed framework. It's a call for humanity to act with responsibility and compassion. Let's work together to strengthen public health systems, improve sanitary and water. And because water is life, water is health, water is dignity, we can all protect and help each other and remain one of humanity's highest shared responsibilities as one. I thank you.